Good afternoon, everyone. Thank you for being here today. Today is our monthly Livingston community-based webinar. Before I introduce our speaker, I want to go over some housekeeping notes. As always, our webinar is recorded and will be available for viewing post the presentation. It will be available on our website. If you're having any issues or any IT trouble, please use the chat function on your Zoom app to send in your questions. We will do our best to help assist you with that. If you have any questions during the presentation, please use the chat function as well to send in your question. We'll do our best to answer all the questions during the presentation. All questions and answers will also be posted on the website after the presentation. So our guest speaker today, today's topic is in-home care option. This is the services that Livingston provides. So today's guest speaker is Lisa Crone. She is our Livingston's very own nurse clinical liaison. Lisa has been with Livingston for over a year and has been a practicing clinician for more than 30 years. Lisa started her career at UCLA's Trauma Center, then worked for Blue Cross of California for 15 years, where she helped develop case management and disease state management programs. She later transitioned to operating her own residential care facilities in Thousand Oaks, where she developed a passion for elderly and geriatric care. Lisa earned her nursing degree at Moorpark College, and in her free time, she enjoys gardening, traveling, and volunteering at her local church. So without further ado, Lisa, welcome.
Thank you.
So Lisa, tell us about your role as a clinical liaison for Livingston. What is that like?
So I go to most of the hospitals in Ventura County, and usually a case manager or social worker will call me. And they'll tell me, we have a family who, is faced with a difficult situation. Their disease may have progressed, and they would really just like to talk to somebody to think about palliative care or maybe hospice care and find out what are their options and what services are available.
And what's that experience like? Do you face any challenges or any barriers meeting with patients and families as you present those options?
Yes, so in most cases, I think there's a lot of misconceptions about what the differences are between home health, palliative, and hospice. So home health is typically, pretty simply, say you have a knee surgery and you need to have a physical therapist come after in your home to help you get back to the way you used to be. So home health requires a doctor's order. You have to have a skilled need of a nurse or a physical therapist. And it's usually for a limited amount of time. Palliative care, on the other hand, is what I would call home health plus.
Mhm.
It's usually for somebody who has a pretty chronic condition, could be life limiting. You have to have a particular symptom that may be difficult to manage, such as, say, a patient is diagnosed with cancer and their pain is very hard to manage. And so that would be a perfect candidate for somebody on palliative care because they're actively seeking treatment and they want to get better, but they want their symptoms to go away.
Okay.
And as you can imagine on chemo, a lot of people have lots of differences. So,
Absolutely.
yes.
So they can continue with their curative treatment that's set forth by their medical providers, but also receive palliative care in the comfort of their own home.
Yes.
Okay.
And through their primary care physician, if they need, say, a hospital bed or a wheelchair for that period of time, that's usually provided by their insurance as well. And then hospice care is for somebody typically who is, in a doctor's best judgment, they will recommend hospice when they think that somebody has 6 months or less to live. Nobody has a crystal ball.
Right.
Nobody really knows. But hospice care is for people, most often when I go to the hospital and I'll ask the patient questions. And when I hear them say things like, I've been to the hospital, 6, 7 times this year, And every time they come, there's less and less they can do for me. I'm done. I really do not want to continue my treatments. I just want to go home and be in peace.
Right,
You know, that's usually a good indication that somebody's ready to start having that discussion.
right. So is that the main difference between palliative and hospice?
So the main difference is you are no longer seeking curative
Okay.
treatments.
Okay,
Yeah.
so focus on comfort, care at home, or wherever they call it home.
Yes, and there's different locations
Mhm.
that you can receive hospice. You could receive it in the home. You could also go to a residential care home,
Okay.
which is commonly called a board and care home. We can also do hospice in the larger assisted livings. Or under some insurances, Medi-Cal in particular, you can receive hospice in a skilled nursing facility.
Are there criterias or things that you need as a patient to qualify for home health, for palliative, or for hospice?
Well, let's take hospice first.
Okay.
So Medicare has pretty strict guidelines and believe it or not, you do have to qualify for hospice. So for example, if you have a heart condition, it could be very specifically your symptoms, like for example, you need oxygen. And without the oxygen, the level of oxygen in your blood drops pretty severely. Okay, if you had an echocardiogram and your ejection fraction registers at a certain level. There are some ways that we can look at clinical records if you're in doubt, and you think hospice is appropriate. The best thing to do would be to have your doctor, tell your doctor what you're thinking. Have them send us your clinical records, and in discussion with your doctor, we can have that discussion.
See if that patient will qualify
Yes.
for hospice. What about palliative care?
Palliative care should also be discussed with your doctor.
Okay.
If you are a cancer patient
Mhm.
and you've received, treatment, and what some cancer patients may or may not understand is that sometimes chemo can be considered a life extending kind of treatment, especially for somebody who may have shown signs of a metastasis. They may be doing chemo just to kind of keep the tumors from growing. And that's a perfect indication that somebody would benefit from palliative treatment with us.
Okay.
Because we can help during that time. A lot of times these patients find themselves in and out of the emergency room.
Right.
That's not a pleasant experience.
Absolutely.
And so if you're at home on palliative care, we have a 24-hour nurse line that you can call, and we can help and assist you. And possibly, if it warrants the necessity, we can send out a nurse
Okay.
to see you instead of you going to the ER.
So what are the visits like on someone receiving home health, hospice, or palliative care? Are the nurses or the clinicians there 24/7 in the home?
No, and I'm glad you asked that because that is a misconception.
Okay.
Medical insurance pays for medical care. In today's world of medicine, it can be very fragmented, but it is primarily driven by insurance. It has to be medically necessary, and it has to be for skilled care. The typical care that somebody needs 24 hours a day is referred to as activities of daily living. It's things like bathing, dressing, personal grooming, eating, toileting. That is not covered by medical insurance. And so another name for that is custodial care.
Okay.
And that's usually private pay. That's where assisted living homes come into play because they provide that and you pay for them privately.
Got it.
Some people do have long-term care insurance that might pay for that, but medical insurance doesn't cover it.
So the visits, the nurses, they go to the home, the clinicians, they go to the patient's home, they provide intermittent care. And then what does that visit look like? What do they do?
Well, the visit itself could be 45 minutes to an hour, depending on what the need is.
Okay.
The nurse would typically come in, probably do vital signs, probably reconcile your medications, make sure that you're taking what the doctor has ordered.
Right.
You answer your questions, and probably coordinate making sure that you're seeing your doctor and the appointments and you're getting the care and your symptoms are under control.
And now for hospice, where they're no longer seeing their doctors outside of curative treatment. So what is the nursing visit or clinical visit different at that point?
Yes, so one of the things that you mentioned is they're no longer seeing their doctor. Typically, when a patient comes on hospice with us, our medical director will take over and oversee the care of that patient. There are instances in which a patient may want to continue with their primary doctor. Primary doctor has to agree to it. Many of them don't have experience with hospice. Our medical director, Dr. Dial, is always willing to talk to the primary care physician in consultation if needed. But Dr. Dial has been a hospice doctor for many, many years.
Yeah.
And it's my understanding he even trains other doctors to be hospice
He started, I
doctors.
believe, here at Livingston as a hospice doctor, I believe 1985, so almost 40 years, yeah.
Yeah, so he's really an expert at what he does. In fact, my own mom was on hospice with Livingston, and
Oh, wow.
I had Dr. Dial as
That's the physician.
yes, and I trust them very much. So when we talk about a doctor seeing the patients, our nurses go out and they're kind of like the eyes and ears of the doctors.
Okay.
So a nurse can come to the bedside, and this is really a good benefit of using Dr. Dial as the medical director under hospice directing care, is because our nurse can go out and let's say there's a new symptom and she thinks that the patient could benefit from a different medication. She can take out her cell phone and call Dr. Dial. He picks up and answers, and she says, this is what's going on, and he'll say, okay, call in an order to the pharmacy for X, Y, and Z. And within an hour or two, it's delivered. That's kind of unheard of.
Yeah,
In
absolutely.
today's world where it could take a couple of days to get a prescription and then get it filled at the pharmacy.
Absolutely, and it's a big relief for the patient and their families to make sure
Yes.
that that's truly the beauty of hospice is making sure that your loved one is comfortable and pain-free.
Yeah, because hospice is really all about symptom management and making sure that the patient is comfortable and not experiencing pain.
What other benefit is included under a hospice? You know, you mentioned a hospice doctor and then a team of interdisciplinary professionals. Are there any other services?
The professionals, the clinicians that are dedicated to hospice are nurses, RNs and LVNs, and a home health aide who will also come twice a week to bathe the patient or shower them. And you also have the services of a home health, a medical social worker.
Okay.
And they can help with, referrals in the community.
Community resources.
Yeah, they're a great resource. Like, for example, if you have to have legal paperwork done, they know how and how to get that accomplished. They can also help with, picking out a mortuary and funeral arrangements. And then you also have the services of a chaplain who's available to help for spiritual care.
I know when my grandma was on hospice, like utilizing this, like just family support through social services and the spiritual chaplain was a really big, was a game changer truly for my family, and having that, just how much someone walking us through like the mortuary arrangements and even discussing, like my grandma started on hospice as a full toad, and having the social worker and the nurse walk my family, not just through like the medical component of it, but just the psychosocial aspect of choosing switching to a DNR. So that was a big support for our family. So it's a really good service. Are there any equipment, medication, are those included?
So additionally, all of your durable medical equipment, Your hospital bed, bedside commode, over the bed table, wheelchair, we have regular wheelchairs, we have transport chairs, we have high back chairs that recline.
Wow, okay.
Hoyer lift, if there's a doctor's order for that.
Mhm.
We'll also send a physical therapist out to do safety training on how to use the Hoyer lift.
Yeah,
Um,
supplies, is.
oh, supplies, yes, the
yeah.
nurse will bring, briefs, chucks,
Yeah.
gloves.
It's definitely a really comprehensive
It is.
benefit and service, and as a care transition liaison, one of the things that I always hear out in the community is like, gonna pay for all the services. Yeah.
So Medicare, if you have Medicare Part A, they will cover 100% of hospice.
Okay.
In most cases, everybody's insurance, as you can imagine, is a little bit different. It also includes all of our hospice medications.
What is a hospice medication? Are those different from regular medications?
So we use special pharmacies that keep our medications in stock.
Okay.
Typically, liquid morphine
Okay.
and Ativan are the two primary medications we use on hospice.
So like address symptom management and pain.
Yes.
Okay.
Yes.
Got it. Now, another question that I always hear out in the community is like, well, where do my mom doesn't live at home. My mom lives in a facility. So where are these services provided, Lisa?
Good question. So, sometimes I'll go into a hospital and the family is awful. It's could be an awful situation where, it could be sudden. And I try to work through that with the family. But at a certain point, you come to the hospital's looking to discharge the patient. And so the family sometimes is surprised that they have to take the patient home. And so in a lot of cases, it comes down to finances and budget. So families who decide to take their mom or dad home or another family member, they are the ones usually providing the care.
Okay.
And it's our job to come in and help and support them by training and education and being available. We have a 24-hour phone line where they can call. And I always stress to families, if you see a new symptom, if you see a change in condition, if you see a symptom that's not being managed, call. Because we have nurses on the phone that can help you.
Absolutely.
Let's say somebody's symptom has gotten worse. So we may make a medication adjustment on the phone, but it's the family administering the medication.
Okay.
And we'll tell them, call us back in 10 or 15 minutes. We want to make sure that the symptom that's been affected.
Absolutely.
So if they call back and they say no, and you send the nurse out, we may try another medication first, if it's not that severe, but we would definitely send a nurse out if it's warranted.
Oh, God. So like while the nurses are not there 24/7, there's 24/7 on-call support.
Yes.
And we will dispatch a nurse
Yes.
if needed. Now, can you describe or just maybe explain like maybe challenges or like your experiences has been as you talk to the families at the bedside of there's been a big change in condition, mom just had a big stroke, and what are those challenges when you're meeting with them at the bedside and delivering the news and explaining options?
Well, there's lots of different challenges. One that I can think of is when the patient and the family don't agree.
Yeah.
I run into a lot of cases where, you may have a mom or dad who's 80, 90 years old and they're saying, let me go. And the family isn't ready. So in that case, I usually ask the hospital social worker to get involved, possibly the chaplain, and hopefully give the family some time to decide. We've had some patients go home from the hospital on palliative care and started with palliative, and then over time as they can, go from the denial phase to more acceptance, realizing that this person is not gonna get better, they can just call us up and initiate hospice right in the home.
Okay,
We'll do a lot of the legwork as far as how to make that happen, so they don't have to worry about it.
right, okay. Now, I'm sure we have people who are watching now and wondering, how do I get Lisa out? How do, if they find themselves or a loved one in a situation where they're needing in-home care or just resource, what are the steps they should take?
Well, the best thing to do is to call our hospice line, which is 805-642-1608.
Okay,
And I always, even for our current patients, I always say you don't have to remember a lot. Just call us and tell us what's going on.
right,
We will figure it out. When you become a patient at Livingston, I always say it's like we're one big team. You're not in this alone.
absolutely,
We will hold your hand and walk with you every step of the way.
yeah, absolutely. And one of the things that I really find so meaningful about the work that we do is when you and I would meet with a patient at the hospital and, we hold the daughter's hand and really she just wants to bring mom home and we're able to make that happen and you see the sigh of relief and it's knowing that she was able to honor her mom's wishes because we were able to help and support her and she went from not knowing any resources to having this full team, really helping her make, her mom's wishes come true to get home.
It's very
Yeah.
rewarding.
Absolutely.
Yeah, I love the work that I do. I meet so many wonderful families.
Yeah.
And I feel kind of blessed in the sense that I'm entering their lives at a time where they really need help and
Yeah.
support. And with my knowledge and experience, I can step in and just educate them and offer them different options that maybe they didn't even know existed.
Absolutely.
And we have a good talk and there's always no pressure.
Yeah.
I always feel that it's better when people are informed so that they can make better decisions. And so most often, a lot of times, I'll go to leave and I'll put out my hand in the snow, they wanna give me hugs.
Oh, my goodness.
Yeah,
Yeah,
so-
absolutely.
Yeah, so it's very rewarding.
Yeah.
I love the work that I
I
do.
definitely resonate with you when you say it's, you're walking into their lives at just a very vulnerable time.
Yes.
For me, just consider it such like an honor and a privilege to be led in someone's home during just probably one of the most
Yeah.
difficult, most, painful moments of their lives,
Yes.
and they're just entrusting us to help them, and there are very few jobs that will allow you to do that.
That's
So,
right.
absolutely. Well, you've given us a lot of insight today. I just wanna, we do have a few questions that came up during the presentation. One of the questions that popped up is, once they requested the order from the physician for hospice care, how long does the process take?
Oh, well, that varies.
Okay.
Okay, so once we get the order, and as long as we have the clinical records with the order, it's funny because I know your team will drive around to the doctor's office and actually go and pick them up.
Absolutely.
We'll review them immediately. It's not something that gets put into an inbox when we get around to it.
Yeah.
Those orders that come in are reviewed immediately and I'm available, and I know that we have other staff available to go out and meet with the patient, the family, sign hospice consents. I usually assess the patient's needs and figure out what durable medical equipment they need. I can call, or we have a special text messaging system where I can place the order. Usually when I'm sitting right there, our equipment company will actually call the family and say, okay,
Yeah,
the equipment's gonna be delivered between 10 and 12,
right,
and they're astonished that it
Yeah.
happened that fast.
absolutely.
After that, I usually call the case manager at the hospital and we speak with the family about their wishes. Sometimes they have to go home and rearrange furniture to make room for the equipment that's coming. If everything is set, we can arrange for transport through the hospital, and we've done hospice admissions in like 3 or 4 hours.
Yeah,
Yeah.
absolutely.
Yeah.
Okay. The next question I have is, can I receive palliative care and hospice care at the same time?
No, and that's not our rule.
Yes.
That's the insurance rule.
Right.
Yeah.
Let's see here, I'm just going through my notes. How long can I be on home health or palliative care?
Well, when the skill need is met on home health, then it goes away. We only get a certain number of visits
Okay.
on home health. And on palliative care, that's a little bit more gray. But we've had some palliative care cases go on for quite some time. And so there's less of a limitation in that sense. As long as the skilled need does still present itself, but usually the symptom management is something that, is something that extends beyond what home health typically is.
The last question I have here is, how do I initiate any of these services? It's a physician's order is needed. Do you
Yes,
recommend that they
So-
reach out to their doctor?
so for home health, I would say, I recommend that you reach out to your physician and request home health. They would need to send us an order. For palliative care and hospice, if you feel that you or your family member could benefit from it, I would say give us a call
Okay,
and we can handle it from there.
okay. So we'll take every step that we need to make sure that we,
Yes,
make the
it's
process as
also-
seamless as possible.
It's also it's a good practice to call your physician and let them know that you did that.
Yeah.
And ask them to work with us on behalf of you for your care.
And I think really the important thing here is advocating for themselves, for your loved one. If you feel that they could benefit from any form of in-home care, if they're of Medicare age, especially, that there is absolutely no harm in asking your
That's
physician
right.
for, I think my mom could benefit from home health physical therapy.
Right.
And there's no harm in asking.
Yeah, something I wanted to mention, Pauline, is I've just run across two cases recently where the person was ready to go on hospice and I was signing them up when we got to the discussion of medical equipment. And I found out that the family had already gone out and purchased their own
Yeah.
hospital bed and wheelchair, and they don't need to do that.
Yeah. It's a Medicare benefit.
Yes.
And that's one thing that we always advocate and explain to the family, that home health, hospice, and palliative care are Medicare benefits. And that they worked their whole lives for it. So use it, right? Yeah. Well, thank you so much, Lisa, for your insight and all the information you provided. If you have any question, looks like there's one more question that popped up, Lisa, so I'll go ahead and ask. Should I assume a person coming on to hospice care will pass within days of their start of service?
Well, like I said before, nobody has a crystal ball. But the answer to that is no. We obviously do have patients that come on care and pass very quickly. But we've also had people on care for like a year, 2 years. Nobody knows the day or the time. But if they could benefit from hospice care, and everybody should know that in no way, shape, or form does hospice care hasten death. The medications we give are in very low quantity. They don't, well, I've had families say, is it gonna kill my dad to give morphine? No, and they're not addictive either. So the care that they get under hospice helps them. It helps during the natural process of dying.
Absolutely. Yeah. And if there are any questions that you have, like family members have questions about the medication and the effects of it, like that's one of the benefits of having a hospice medical director who's trained in, palliative and hospice care, even our nurses, it's always open for discussion. The family and the patient, they're really the driver of the care. And
Yes.
if there are any medications that they're not comfortable taking, that I know Dr. Dial, and I can speak for a lot of our nurses, that they're always open to discussing that and making sure that everyone is comfortable with the plan of care.
Yes, and just because you go on hospice does not mean that, oh, I have to immediately start taking morphine. We
Absolutely.
have many patients on hospice and they're not taking the hospice medications. So that is a misconception.
Absolutely.
Yeah.
Yeah, it's with hospice, I feel that it's really what we promote is the better quality of life. So you can, you know, our patients and can enjoy that phase of their lives with their loved ones in the comfort of their own home. And so it's truly a benefit. We, like what Lisa mentioned, we have patients who pass within days of starting hospice, and truly we push for patients to start hospice care when they're no longer seeking aggressive treatment or curative treatment is no
Right.
longer realistic.
Yeah.
Because you get the full benefit of hospice. I can speak personally as what my grandma was on hospice for 5 to 6 months, and she not only benefited from that, but me as her granddaughter, as her care provider, I was able to take a step back when a hospice nurse is there and remove that caregiver hat off and just be a granddaughter and just love on her, and to see how much she's changed from being poked and prodded in a skilled nursing facility or a hospital to just being home.
Well, and that's an important point because a lot of people, they're getting their treatments and it's making them sick.
Yeah,
So I have a lot of people who go on hospice who say they're so tired of the treatments. They want to enjoy whatever days that they have left. So they go on hospice, they're not getting their treatments, and sometimes they feel the best that they felt
Absolutely.
in quite some time. And maybe they don't, you know, our nurses will still come, you know, twice a week to check on them, but they're not really sick now.
right,
And they're out there enjoying their life.
Yeah.
And they know that if they have any symptoms, we're just a phone call away
with their safety net.
to be
Yeah.
there and help them instead of going back to the ER.
Right.
So that's one of the best things that a family told me was it gave them back their quality of life.
That's right, yeah.
Yeah.
Are there any other questions? Please feel free to unmute, or you can also type your question using the chat function. Well, thank you all very much for attending our webinar for this month. Again, Lisa, thank you so much. And this presentation will be recorded and being recorded and will be uploaded on our website in a few days. Thank you.